I didn't know my mic was on. Make your mic so I can see it.
All right, good morning, everybody. I'm going to pull this up a little bit. I know lots of folks here today, but for those that don't know me, I am Dr. Stacy Sanford. I'm a clinical psychologist, and I'm also the director of our adolescent young adult program. So shameless pitch, this is our webpage if you've not seen it before. We're always trying really hard to get information out to our young people. We're so dispersed over the Cancer Center and Children's Hospital and all over the place that it's hard to reach people. So this is always a good resource for you if you want to know about upcoming events, clinical trials that are opening up. Some of our young folks here today have posted some blogs, resources, anything like that. And also feel free to reach out to me directly. I don't know if if you want to write this number down. I don't know what just happened there. Something weird just happened there. But my direct phone line, if anybody has any questions about the program or any services, feel free to call me directly. It's 312-695-2356. I have no idea what I touched. I thought it was just the mouse. So I want to thank you. I want to welcome our panelists here today. And please give them a round of applause for coming to share their stories and taking time out on a Saturday. I also want to thank the people who helped organize this, Kate Harkin, Jessica Voights, all our Board 39 members, and everybody else who's participated in helping this event happen today. So we really appreciate your time, all our speakers too. So in the interest of time, I'm going to read really quickly through these bios. Excuse me. I'm going to start with our professionals today. If you guys could just raise your hand as I introduce you, that would be great. I'll start with Karen Kinahan. Karen is our clinical nurse specialist here at the Robert H. Lurie Comprehensive Cancer Center, and she's spent her entire 29-year nursing career in pediatric oncology and the past 21 years working with survivors of childhood cancers exclusively. In 2001, she started a comprehensive follow-up program for adult survivors of childhood cancer called the STAR program, and she helps facilitate long-term follow-up care for hundreds of childhood cancer survivors. And her role includes direct patient care, patient and community education and research. And Karen is recognized as a nursing pioneer in the field of childhood cancer survivorship and adult transitions. And when we talk about childhood cancer survivors, we're talking about people diagnosed 21 and younger, right, Karen? Yep. So that's the bridge there with the young adult population. Okay, next is Megan Slocum. Megan's a physician assistant working in the Adult Cancer Center. She works in survivorship clinics at Northwestern, and she has worked with other members of the Cancer Survivorship Institute to develop it and implement a comprehensive program for cancer survivors that includes follow-up care, education, and research. So thank you, Megan. Now I'm going to introduce our young adult survivors. So Ben Bornstein, yeah. Ben is the new CEO and executive director of Emmerman's Angels, and he's a non-Hodgkin's lymphoma. He had non-Hodgkin's lymphoma at ages 14, 15 in 1985, 1986, and he had 18 months of chemotherapy, spinal taps. He was treated at University of Michigan under the care of Dr. Lawrence Boxer, who's the head of pediatric hematology oncology. And then at the age of 28, he was diagnosed with squamous cell carcinoma of the tongue. He had a hemiglossectomy, which is having half of his tongue removed. Did I say that correctly? Feeding tube speech therapy, lymph node dissections. He was treated by Dr. Gregory Wolf at the University of Michigan. And then at the age of 43 in 2014, he was diagnosed with skin cancer and had surgery here at Northwestern with Dr. Alam, and Ben's 45 today. So he's got a long story there. I'd also like to introduce Tina Chip. Tina Chip was diagnosed with Hodgkin's lymphoma at the age of 16 and was treated with 4 months of radiation. After graduating college and starting her television career, she was diagnosed with stage 3 breast cancer at the age of 22. She was treated again with radiation, chemotherapy, and bilateral mastectomies. She was single and dating during that time of diagnosis and treatment, and she started a networking group of young women since she didn't find a lot of resources in the community at the time. She was also a hotline counselor for others during treatment through Why Me. She married at the age of 29 and faced many obstacles in starting a family, and then went through IVF and donor egg, and was successful with that. And they also adopted their son at birth. I'm sorry, I read that wrong. Went through IVF and donor egg, which was unsuccessful, but they successfully adopted their son at birth and soon found out that embryo donation was available, and was able to carry and deliver her two youngest children. She's now 44 and has children ages 3, 6, and 11. Did I get that right in the end? Thank you. And then finally, I'll introduce Alexis Bone. Alexis is a nurse here at Northwestern, and she worked at the surgical intensive care unit for 7 years prior to joining the quality utilization team in the fall of 2013. Alexis holds a bachelor's in nursing from the University of Michigan in Ann Arbor. At the age of 27, she was diagnosed with cervical cancer. After undergoing fertility preservation, Alexis' treatment plan included a radical hysterectomy, and now almost 3 years cancer-free, Alexis lives life to the fullest. And when she's not working, Alexis can be found out on a run, cooking, or traveling with her husband. So thanks again, guys, for joining us today. All right. So I'm going to start by asking our professional panelists just to talk to us a little bit about survivorship and what we mean by survivorship for the purposes of this presentation. So Karen and Megan, can you tell us a little bit about your programs and the services you provide and why that's important to our cancer survivors?
I'll start. So I guess I work, as Stacy said, with the STAR program, which is for patients diagnosed at 21 years or younger. So it's childhood cancer survivors, young adults, adolescent, young adult. And we follow them here at Northwestern for the rest of their lives, right? So their cancer is typically over. Sometimes we have secondary cancers, but it's focusing on not so much the original cancer, but the late effects of treatment. So it's a specialized program with myself. I work with an internal medicine doctor, Dr. Didwania, and then we have a psychologist team. So the three of us kind of as your core group, focusing on, just risk-based care. So what kind of treatments did our patients receive? What kind of screening do we need to do? And in childhood cancer, we have guidelines for follow-up care, which are followed nationally and actually in North America through the Children's Oncology Group. So we're very fortunate in that. They're evidence-based, and we sort of set up testing. So most of our patients come back once a year for an annual follow-up visit. In addition to their focusing on just their cancer, and those, we also do general medical follow-up care. So looking at blood pressure, lipids, like just things that you would get from your general doctor too. So we kind of incorporate that into our annual visit. If you need ongoing or intermittent follow-up between the year, then people contact me for acute visits, and we kind of get you connected with internal medicine or following up with Dr. Dumania and her internal medicine clinic, which is on the 18th floor Galter. We hold our STAR clinic on 21 Galter. So I guess it's kind of, I always say the three things about our clinic are the patient care, clinical care, research, which we've done. The STAR program is actually a study, but also then education. So education one-on-one in clinic with you about what your treatment entailed. And as you can imagine, this might be the right population here, but some patients are diagnosed at 2, 3, 5, 7 years old. They don't really remember a lot of it. So a lot of it is like getting them to kind of know their information, know their treatment, know their late effects, and then kind of in a sense, I guess, own that eventually, and then to try to take on their care as young adults as they get older. And we have many patients that are in their 50s too, so not all of them are in their 20s and 30s. So it's because we'll follow them for life. So.
And we essentially mirror this with the adult clinics. We see survivors of cancers that were diagnosed in adulthood. Our clinics are a little bit more disease specific, so we have the women's cancer survivor program. We see breast survivors, uterine cancers survivors, and we will be expanding to ovarian and cervical. And then we have another general adult survivorship clinic in Galter that sees survivors of many other cancers. Right now, mostly colorectal and testicular. Those are the two that we're seeing the majority of. But we really serve as a transition point from oncology care back into primary care and a point of contact between oncology providers and other primary providers.
And the one more thing I just want to mention too, I think that it's important to note, when you come into survivorship, we're not necessarily looking for reoccurrence of disease at this point. I mean, that's, through blood work and exam, like we'll be focusing on that. But like this CAT scans and PET scans, those things have typically ended by the time you're transitioned into survivorship. So focusing on your health as a survivor and your health moving forward, that's kind of more the focus on the survivorship in comparison to like the on-treatment clinic.
I'll ask one more question of you guys. Can either of you tell us a little bit about the shared care model and how that is involved with survivorship care?
I can talk about
Karen
that.
knows as well.
Yeah. Okay. So there's a model of care that's actually more for chronic illness in general. It's called the shared care model, and you can look it up in the literature. Basically, kind of indicating that there should be more than one provider involved in the patient's care. So this has been proven to be effective in diabetes and renal disease. But basically what it's saying is that the ideal model to strive for in shared care for cancer would be that a patient, maybe has a primary care provider, their general doctor that they have, and then they get diagnosed with cancer. Well, then the oncologist, that team sort of becomes the main player, right? But at about 1 to 2 years off therapy, they'll transfer back to the primary care provider as their main player with intermittent follow-up with the oncology team. But the main point about this model, why I think it's important, is that there are points of communication then between the providers throughout the whole cancer trajectory. And so that's in a sense what the main point of that model is, that you have a team of providers, that your oncologist takes care of your cancer care, but then your primary care provider takes care of your general medicine care. But the more they know about it and the more you promote communication, asking each other to communicate back and forth, for instance, anybody getting a primary care provider, if you don't have one, then in the long run, your care is going to be more solid, and you'll be happier with it too, I think, because they'll have more information about what you went through, what your, the point of issues. Even screening tests that might need to be done can be done through the PCP, because at some point you might move and not be able to come to your oncology team. So you need to work with being your own advocate with a primary care provider.
Thank you. So now that we have a little bit of background and overview of survivorship care and survivorship care planning, I'd like to ask our survivor panels to talk a little bit about how you have secured your survivorship care post-treatment and the resources you found useful and advocating for yourself.
Okay, I can start off. I could also, just as a plug to Karen and her team, I've been a participant in the STAR program, so as a childhood cancer survivor, and then again as a young adult. It is somewhat of a unique resource. I've lived a lot of other places before here, and survivorship has become a much bigger focus, and the awareness of it has been huge in cancer centers, so that kind of coincided with my coming to Chicago and getting involved with Northwestern. But it is a nice resource, even for any of you going through this, to navigate through the mass expanse of the hospital network. Who do you need to call for what? I started having, for example, bone density studies done here for the first time related to my childhood cancers that nobody ever mentioned to me before in 5 or 6 other cities I lived in. So it's a great program. I would just say quickly, and I jotted down, one of the biggest resources you can bring to the table you came to the conference with, and that's yourself. You can be your biggest advocate when you're going through a cancer experience, and you have to be. You can't, there's lots of resources out there, but you can't just say they're out there and hope that they come to you. You really have to advocate for it yourself and be your best advocate. They have programs here and everything from mindfulness to support groups and groups or one-on-one care as well. The second one I'd share with you guys is just the medical team. They are human beings. It depends on the personalities, but a lot of them are very nice, and we'll have relationships with you, text relationships, email relationships, even outside of the office, and that can be another thing that you have to advocate for, but can happen for you. And the other two that I'd mentioned quickly are family and friend networks, and be selective. You know who your family and friends are that will be more nurturing and more emotionally engaged with you as you go through something like this than others. And then just outreach groups. I mean, everything from Gilda's Club, Board 39, which is a Northwestern group of young adult cancer survivors that is very active here at Northwestern. Embryo Angels, which I'm now been running since January, that does one-on-one cancer support, and lots of other groups like that in town. So that's what I'd share.
Thank you.
So I would piggyback on what was just said. And the other thing is, for me personally, I had cancer at 16. So my parents kind of led the charge for my therapy. I kind of just did what I was told. So I didn't have a real active voice. So when the second cancer came around at the age of 22 and I found out it was a cause from all the radiation I got, that's where I went and said, I need to take charge and be more active and make sure I find and seek out all the resources. So now as a survivor, 27 years later for the Hodgkin's and 22 years post the breast cancer, I recently became a patient of the STAR program. And I was just reminded I'm due for my appointment too. Oops. So wait for the day you forget about your appointments. But I think just know that no matter where you are in your survivorship journey, you still can become a new patient in a program, but also becoming your own advocate. A huge disconnect for us being young is once we're done with treatment, we're going back to our primary care physician. Our primary care physician assumes, since we're still seeing our medical oncologist, they're following us for long-term effects and watching us, where the reality is they're really seeing us for why we first came there, right? And so it's an education, an opportunity to educate. What do we have to look out for as a survivor? What were the treatments that we have? Be armed with that information and have that talk with your primary care doctor. And if it's cardiac toxicities and you can't get into a program like STAR because feasibility to come into the city, but it is only once a year, advocate, like, should I be having a stress test? Should you be checking my lipids? It's really arming yourself and becoming your own advocate. And it's okay, because unfortunately in this situation, you probably do know more than a lot of the primary care physicians out there. So
I was diagnosed at 27. So for me, I'm now 30. And for me, I felt like there was a period of time where I was just very angry, and it was very why me, and it's isolating. And I did actually utilize Immerman's Angels, and I'm now a mentor. And for me, that was the biggest step into kind of becoming like the new person I am, and getting involved and doing other things and finding new programs for myself. I felt that kind of gave me perspective. Yeah, my situation sucked, but there are so many other people who are fighting different battles, harder battles, easier battles, doesn't matter. Everybody kind of has something going on, and it gave me the perspective that I'm really lucky that my cancer was caught when it was, and that we were able to solve it the way we were able to solve it. And it made me very grateful. And I think leaning on other cancer survivors was a big part of my kind of emotional recovery in the years after my cancer treatment ended.
And I'd like to add, that's the other piece of it. Our family and our friends are amazing support, but trying to connect with someone exactly in your shoes to give you that inspiration. My first contact when I had the breast cancer was with a volunteer in the hospital. But what was cool is, like, she was the first person that I had met that had survived breast cancer. Because up until that point, I was just surrounded by family and friends. So, seek them out, whether it's through Immerman Angels, Gilda's Club. I saw a lot of great groups out today. Know that those resources are out there. It doesn't show a sign of weakness. I actually think people who seek out is a sign of strength, because you do want to find to get you through this journey of cancer.
Great. Thanks, guys. Now that you've talked a little bit about some of the resources that you found really useful, would any of you be interested in sharing with us some of the more challenging things that you had to face, and how you managed to deal with that, either with yourself, with your family, or with your medical team?
I guess I can start. I mean, I think it really is very dependent on age. In my own case, my first cancer, non-Hodgkin's lymphoma, was in high school, so that is a difficult time as you're a teenager, same as Tina's experience, I'm sure. You know, it's not fun to be different. It's not fun to have your hair falling out. You probably barely even understand some of the fertility issues you're dealing with as you go sterile from chemo and things like that, or radiation. So, you know, you're not so much as worried about marriage and kids at that point, but you are thinking about dating and things along those lines. So for me, I mean, it was always that was always a challenge. I guess all I can say is there was, even at that time, this was the '80s, a community of people that were kind of going through similar things. It wasn't as well organized as it is today, or as big, but that was a great community to lean on. And you do kind of find out who your closest friends are, and other people that can really click with you, even if they aren't going through the same thing you are. And some of those folks I'm still in touch with to this day, or old high school friends that would bring, you know, pizza or games or sports scores and things to the hospital as you're going through treatment. So for me, it was really about that. And the thing I'm excited to see today is just all these different support groups and lots of survivors. So it's a different ball game today. As a young adult, when I went through the second cancer, then mine was a tongue cancer. So the trouble with that was I couldn't talk for almost 6 months. So, and it was just before email was really as widespread as it is, and texting was as widespread as it is. So trying to actually do your job and function, or to pick up the phone, I mean, try to go through even an hour or two without talking, it can be pretty tough. So you go through 6 months of that and some speech therapy. That can be kind of tough. But in that case, I found I had some supportive family, friends again, and then also an employer that was particularly understanding. And that also gives you a sense, career-wise, what kinds of things do you want to do. I mean, ultimately led me away from Wall Street jobs and into doing cancer care full-time, just as something that gave me more satisfaction with Immerman Angels. So that's my story.
And I think for me personally, I've had different challenges of going through my life because, as Ben said, being a senior in high school, it was a challenge because I just wanted to go on spring break. So I specifically made arrangements. My radiation oncologist, I went on spring break because I wanted to do everything I could to feel like everyone else versus saying, oh, I can't because I don't feel good or my counts are low. And then when the breast cancer came around, it was a lot of different issues because everyone was graduating from college. We all were starting our careers. And it was almost like a race. And everyone kept running the race of life. And I kind of was just stuck at the starting line. They were getting married. They were having children. And I was in a year of treatment. So it's different in things and managing different things through your treatment, through your phase of your cancer. And then once I was done with treatment, one issue was dating, right? So, okay, I'm single. I don't know if I could have babies. I have lots of my battle wounds, I like to say. So how do you have that discussion? So it was like trial and error. So my first date, I would tell them everything. I had stage 3 breast cancer, I had 10 positive lymph nodes, and then I'd wonder why they wouldn't call me back. And then it got progressive. We're like, hi, they have to get to know me. I really am a good person. And then I think I'll say, by the way, this is what happened. So it really was trial and error because it's a lot to have to think about. And then I'm like, well, what if I tell them I can't have kids? And they really do. And what if they say this is it? And then I'm like, you know what? It's almost kind of a blessing because if someone is going to leave me for that, maybe they're not the right person for me. So I almost looked at cancer as, right, we got to spin it positively sometimes, even though it can be negatively. And one of my positive spins was I used it to weed out the people that weren't good enough to be in my life and to be with me. So those are the kinds of things that I did in the certain challenges. And in regards to friends, there were some friends that were so supportive, some that I never heard from. Keep in mind, some people don't know how to talk to us. They don't know what to say, so they avoid us. So just keep that in mind. It doesn't mean that they don't care about us. They just don't know what to say. So I always educate people, and this is with any illness or any challenge. Say, I don't know what you're going through, but I'm here for you, right? So.
For me, fertility was losing my ability to carry children was the biggest like long-term effect for me. You think you know when you're like signing on all of these lines and agreeing to treatments, and then like all of a sudden your best friend gets pregnant and you're trying to look excited and you're not. That's challenging in itself too. Just, you don't want to feel that guilt of feeling like that when someone you love is moving forward. And I was very lucky because it was only 3 years ago. I was lucky enough to work with Kristen Smith right away. I think she was like the second appointment I had. And so to undergo fertility preservation and all of that, and then they're telling you, well, you can use a gestational carrier, and like, who does that besides Juliana and Bill? Like, I've never met anyone who's done that. It's not like, oh, you might have to do IVF. It's gonna be a long road or anything. Like, you literally have to find another human being who's gonna do this for you. Okay. But and everybody just, I met with Kristen like 100 times just to be like, okay, so is this like Tinder? Like, do I get to go like, maybe, like, no, yes, or is it like match? And she was kind of like, well, I don't know. Cause we worked through a lot of it together, and luckily I have my husband who stepped out with our 3-week-old baby here today. So the timing and everything, while it felt very unfortunate at the time, I was very fortunate that there were programs like the Oncofertility program here and things like that to kind of help me get to this point. But in the process, just everybody's like, well, just wait. You just had your surgery 6 months ago. Like, okay, well, that's great. I'm not working. I'll just sit back and watch everybody else get pregnant on Facebook and be okay with it. And that's so hard. It's so hard to do, but eventually you get to this point and there's no dirty diaper that will bother you or sleepless night that will make it all. It's all worth it.
I wouldn't, just to add into what's been said, underestimate the emotional challenges of going through a cancer experience. So your medical side is certainly one thing, but you can have a great result on the medical side and still be quite scarred on the emotional side. So it's different for everybody. So I'm not going to advocate it one way or the other, but sometimes having either a therapist, a coach, a life coach that's more, not quite as much the psychology side, but just getting you through life can be quite useful and kind of getting you back on your feet. And that can even happen years later. So, it all kind of falls under the camp of taking care of yourself, but I wouldn't shy away from some of the resources that Northwestern has, or even in private practice, other people that are very good in that arena. It can really get you back on your feet.
Can I just add one thing, and similar to the fertility, and I wanted to speak on behalf of the Oncofertility Consortium, because I am been here long enough and been in this area long enough before there wasn't even a word. And when our patients, many of my patients who are adults of ours with childhood cancer, and they're even adults of adult cancer as well, they didn't have the Oncofertility Consortium and Kristen or anybody nationally now, to come and talk about fertility and to preserve the fertility if possible, and to sperm bank for men. So this field, which you're going to hear about next, is really changed oncology. It's changed my practice. It's for patients that some of my patients who are survivors, who never thought would be able to have babies, have had them because of the technology and the advancements. So it's a true blessing. Like, I've seen it. I met Teresa Woodruff in 2002 when we were just talking about, she'd done ovarian cryopreservation and would our patients be interested in this. And it's been a long process, but it's been an amazing outcome, and amazing work that they're doing, and that have benefited you, patients of mine, future patients. So I just wanted to say that, since I'm the old lady here in this field, been doing this for a while, have seen it before, the during, and now. Just what a great outcomes that most people can have, including the technology and the appointments that people can have and the resources. And here at Northwestern, I've been told we're the Mecca, which I believe we are in this field, but it's been great to be part of that and watch it.
And to Karen's point, I was one of those patients that unfortunately wasn't a candidate, or they didn't even have the time for oncofertility preservation. So what about us that couldn't, for whatever reason, or if it wasn't an option? I just want to share there still are options out there. Don't think that if you couldn't do it, that you won't be able to have kids. So I just met with someone actually on our board, 39, and they're trying to start a family. And I said, you know, if you want a child, you'll get there. You just don't know which road you're going to take. Is it the fertility road, the IVF? Is it the adoption? You know, I tried every avenue, and we as a family were successful as a live birth with our oldest son, and then embryo donation, which I had never heard of. But a lot of couples that go through in vitro fertilization may get pregnant their first time, so they have all these embryos and they can choose to donate them to infertile couples. So my husband and I adopted 9 embryos, and I successfully carried our 2 youngest children. So know that there's always options for us, and that hopefully don't think that the door is closed.
Thank you, guys. I want to ask one more question myself, and then I'll open it up to everybody else to ask questions. Some of you guys are really long-term survivors. Some are newer. Alexis is newer. Would you guys like to share with us, all this time out, are there still things that you struggle with as a cancer survivor, whether it's fear of recurrence, or are there things that you still struggle with, and what do you do with that?
Yeah, go ahead.
I think you're going to always, certain things are going to cross your brain if you have a pain, you know, to think. I think what happens though, it doesn't consume all day, every day as the years go on. But do I sometimes think when I have this persistent pain that, oh my gosh, I've mets to the bone, let me call and order a bone scan? Yes, of course it does. But it's just how you manage and cope. And like what Ben said earlier, initially when I went through treatment, I didn't seek out a lot of emotional support privately. I did networking groups and things like that. But it wasn't until many years later I realized how much the cancer truly did affect me and the relationships. And then I started meeting with a psychologist. So I think just every day there's certain things that will come up or remind you. And it's just how you manage it and know whether you're 10 years out, 20 years out, 30 years out, you can still use services out there, and there's people to help you, so you don't have to do it alone.
Yeah, I mean, just echoing what Tina said, I would say 2 things to echo that. One, most cancer survivors I know are using medical services much more than non-cancer survivors. So you actually are taking care of yourself in ways that others aren't. So that's a great thing. I would say most folks I know particularly went through this in the 80s or 90s when a lot of people weren't making it through. It is a great life attribute in the sense that I think Alexis mentioned that, you know, nothing really phases you. So a bad day on the job, it's not saying nothing phases you, but you can put things in perspective a little bit better, having gone through something like this in ways that if you hadn't, maybe you can't. So it's sort of the positive trade-off. It's the little chip you get in your personality that happens from going through something like this. And then the third thing I would mention, and I would certainly advocate this for folks that either are going through or have just finished or have been long-term survivors. I mean, giving back can be tremendously satisfying, whether it's getting involved with volunteer groups, whether it's doing something full-time, and you just meet amazing people. I mean, I have a lot of friends in the room here who I've met largely through the cancer community. So those are the things I would add.
I personally have found my like emotional survivorship to be a lot like grief. I lost my father just before my husband and I got married, and I remember people saying like, "Oh, it gets better," and I wanted to rip their faces off, like, "Oh yeah, for sure. I'll totally miss him less in a couple of months," you know. And it's not that you miss him less; it's that you kind of learn what triggers you more. You can brace yourself and prepare yourself for those things. So I knew like I would lose my mind every time I saw like a girl walk down the aisle with her dad. So I just started stepping out for that part of weddings, which was problematic as a bridesmaid sometimes, but you kind of realize what your triggers are. For for me, I know that like when my appointments are coming up, I'm a little more on edge, and I'm sure my husband can speak to just that I'm just way more enjoyable. And then afterwards, while you're waiting for results, and then you get those results, and then it's like all of a sudden, you're okay for a while, and then the appointments are coming up again. And as the appointments get spaced out and the tests get spaced out, You know, it doesn't get easier, it doesn't get better, but you learn like, oh, I know, you know, like I know why this is happening, or I know why I can't decide what I want for dinner every single night this week because I have this coming up and I can't think about anything else. So I find it very similar to grief, and just learning more about yourself and how to, you know, what triggers you, I think goes a long way.
And I'll share an analogy that I heard from a patient. She actually described being a cancer survivor as having the radio always on. And she said at first that it was blaring and there was no way to ignore it, but that after time and after working with, you know, some people to help her, she was able to learn just how to turn it down a little bit. She was never able to turn the radio off, but she was able to bring it down to a volume that was not consuming to her.
All right, and I think we're out of time, but I just want to say that there may be some folks in the room who are not pursuing curative care right now, that have more of a management approach to your cancer treatment. And a lot of the resources that these guys are talking about today apply to you too. So just keep that in mind. And we have a lot of representation from people who are receiving that kind of care for their cancer too, on like our Board 39 and be Ammerman's Angels too, I'm sure. So don't be afraid to reach out and ask for that help. So let's just take like a couple of questions and then we'll move on to the next presentation. Any questions for the panel? Go ahead.
Oh, no.
Oh.
But there's right now anyways, our patients were diagnosed at 21 years or younger. So, but no, we have about 60% who are treated actually mostly at Children's Memorial, now the Lurie Children's Hospital, and about 40% treated elsewhere. So, you talk to me.
Call Karen.
Yeah, I'll talk to you afterwards.
I could add in just on the patient side, as a STAR patient, so I was treated at Michigan because I'm from Ann Arbor, is my hometown, so I was lucky that I had a cancer center right there. But I just think of it as having your primary care physician instead of just being somebody that you get a recommendation to. It's sort of a supercharged person who has a lot of extra expertise in the things you might be susceptible to as an adult. So you have a much longer annual physical, you do extra tests, and it just is quite comforting. Plus Karen's great, so you get to work with her.
It's on the webpage. Any other questions? All right, let's give these guys a round of applause. Thank you so much for coming in to share your stories today.